Details of a troubling case are emerging from the Moncton Hospital today. A registered nurse has been fired and RCMP have been called to investigate after two mums-to-be were given a labor-inducing drug without authorization. CTV's Mike Cameron with our top story tonight.
RCMP are investigating a nurse at the Moncton Hospital after officials at the facility notified police of the results of an internal investigation.
We have strong evidence leading us to believe that a registered nurse in the labor and delivery unit inappropriately administered oxytocin to two patients, requiring them to have an urgent cesarean section.
Both mothers and babies are doing well. The nurse has been fired. Oxytocin is routinely used in the labor and delivery area, but it must be prescribed by a physician.
It's an emergency medication that we require to have relatively easy access to, and it's used in a number of different scenarios in the labor and delivery for patients that are in labor, at the time of delivery, and after delivery as well.
Gillespie says the drug will typically cause contractions of the uterus, and if not delivered correctly, the contractions can be too strong. The hospital has set up a phone line for patients and families who want more information. Patients like Lisa Bask.
It was a surprise, I had no idea.
Bask has just heard about the hospital investigation. She had an emergency cesarean at the Moncton Hospital 9 months ago, and she wonders if her case is a little too similar.
Whether or not I'm one of the victims, it's just scary to think that someone would have purposely put a baby in danger, whether it was my baby or someone else's baby.
The hospital is not saying whether other moms may have been improperly administered the drug.
So our investigation at this point has identified these two patients and these two patients alone. Obviously, we're working with the RCMP and supporting their investigation, and that's really all we can say at this point.
The hospital says its rate of cesarean sections is comparable to that of other healthcare facilities. We reached out to the New Brunswick Nurses Union. A spokesman said they were unable to comment on this matter today. We spoke today to a young mother-to-be. Melissa Lavoie is due in 2 weeks. She was going into the hospital, and she didn't want to do an on-camera interview, but she said she was shocked and disgusted that someone would do something like this, especially someone in the healthcare field. Marie?
Thank you so much, Mike. Mike Cameron for us live tonight covering that developing story. Well, Horizon Health offering an apology and trying to reassure patients.
We regret that this situation has taken place in our hospital and sincerely empathize with the patients affected. At Horizon, our goal is always to provide safe and quality care to all of our patients and their families. It is for this reason that this incident is so troubling for all of us that work here. On behalf of Horizon, I would like to apologize to the patients and their families who have been affected by the actions of our former employee. I would like to also assure all expectant mothers that they should not have any hesitations about receiving care here at the Moncton Hospital. We encourage our patients to feel comfortable in asking any questions that they have. Patients and families can also call 1-844-225-0220, and we will ensure that you speak to a member of our obstetrical team. We felt it was important to disclose this information today. However, this is an ongoing criminal investigation with the RCMP, and we want to be sure that we do not release any information that may compromise that investigation.
That number again for patients and families to call with concern, 1-844-225-0220, and we'll continue to track this story.